This is the story of a public-private partnership gone wrong.
I would say this is the biggest scandal we've seen.
The NHS is paying millions to outsource cataract operations.
Oh, my eyesight's much worse than what it was before I went for the operation.
The profits for these companies are eye-watering.
You're not trying to help anybody. You're trying to make money.
But is a profit incentive putting us all at risk? Around the world, an estimated 100 million people are affected by cataracts. In England, over 300,000 cataract surgeries are performed every year.
It's a quick, safe, outpatient procedure that's carried out millions of times every day across the world and is the most commonly performed implant operation. So my name is Saurabh Jain. I'm a professor of ophthalmology. I work at the Royal Free Hospital and I teach at UCL Medical School. Think of your eye like a camera, and a cataract is the lens of the camera that does all the focusing of the light, getting a bit misty with age. So there can be different kinds of symptoms depending on different kinds of cataracts. For example, cataracts that affect the whole lens cause the vision just to become gradually more and more blurry. So people might notice they can't read the subtitles on the screen anymore, or they struggle with driving. And there are certain cataracts that don't blur your vision, but they cause glare. So the first thing is to go to your optometrist or your high street optician, who will be able to check your eyes and say, yes, you have a cataract. Once that is diagnosed, they can directly refer you to us, to the eye clinics, and we will set up an appointment to see you. So if you look inside the eye, and this is the bit that gets misty, and because it gets misty, it doesn't let light through to the retina. What we do in the operation is, through a small nick, we go inside the eye, take out the misty lens by emulsifying it through a special machine and put the new lens in. Because it's all done so quickly, you can do the whole procedure through a tiny nick at the top of the cornea, which is less than 2.5 millimeters. So it's so small, it doesn't actually need a stitch. It just snaps shut, and that's all you need to do. It's a fairly straightforward procedure in most cases. Now, there's a certain group of people in which there might be additional complications you might expect. So they're very old, they're very young. If you've had previous trauma to the eye, the success rates of cataract surgery are very high, and the rate of somebody needing further surgery or ending up with a vision worse than what they started with is less than 1 in 100 or so.
Most of these operations aren't done by the NHS. They're outsourced to private providers. The main 5 are Spry Medica, ACES, Check, New Medica, and Optegra.
The setup with cataracts in the UK is that basically there's a set price set by NHS England, and any qualified provider can offer cataract surgery at that price. So in the 1990s, I think it was, the Labour governments at that point opened up healthcare to any qualified provider, and therefore businesses started emerging that were providing NHS services with public funds and making a profit doing so. And that's proliferated. And in the last decade, an enormous swing from, I think the independent sector were delivering about 20% of the cataracts a decade ago, and now they'll be heading towards over 2/3, I think, this year.
In fact, in the last 6 years, we've gone from 19 private clinics to over 150.
These private companies would just set up a clinic without the NHS locally saying we need an additional clinic in this area to provide cataract care. They worked out that the rules are such at the moment that if they set up a clinic and they start treating NHS patients, then the NHS has to pay for them. And we know that happens in normal market economy, but when it comes to healthcare, it's not normal. So I'm David Rowland, Director of the Centre for Health and the Public Interest, and we've just done a big study looking at the growth of for-profit companies delivering NHS-funded cataract surgery. This, for me, is the largest scandal that we've come across, and there's 2 reasons for that. One is the very, very large amounts of money that are leaking out of the NHS, £169 million a year, which is around 1/3 of the money that goes towards the provision of NHS funded cataract care in the private sector is leaking out in the form of profit, plus the fact that very large numbers of the NHS ophthalmology profession have financial incentives and financial stakes in the growth of this industry, and that is impacting quite significantly, we think, on the actual delivery by NHS hospitals.
So the way we run a service is we have different parts of the eye service in a big hospital. There will be services like Cataract that actually make money. Why? Because you see a patient, you do the operation, you discharge them, and that's profitable for the department. Whereas there are other services like glaucoma, right? Once you have glaucoma for life, but you don't always do a procedure on them, so they are not the profitable patients. So when you have companies come on and remove this plank from our services, suddenly they become unviable. So not only does it affect training, but also affects the provision of service to the local community.
At the end of the day, we as a society, we decided to put up this offering of a certain amount of money for delivering cataract surgery, and you can't therefore blame business for behaving like a business and noticing that they could make a profit. You know, it's like putting a big plate of food in front of a hungry man and then blaming him for eating. Businesses behave like businesses. When they see profit available, that's what they're going to do.
When you've got companies that come in and just set up, the local NHS doesn't have the ability to plan for patient need, then what you see is a massive skew of resources away from what you might want to spend your money on to servicing the needs and interests of these companies.
Last year, the NHS paid out £536 million to these businesses. Like David said, £169 million of that was private profit for the 5 biggest providers.
So then there becomes a question about, well, if these businesses are going to keep on growing and expanding, are the people that they are treating for cataract surgery actually the people who need it most? And whilst cataract surgery is an amazing operation, it's very safe, with all forms of surgery, there's a risk of something going wrong. So the more people that you treat potentially unnecessarily, the more likely it is that you'll start seeing harm which is not justified by the actual need for removing the cataracts.
It might only go wrong for some people,
Zaza, come here.
but when it does, it's life-changing.
I despise this industry. I'm Sasha Rodoy, and I had my eyes operated on in 2011. I had laser eye surgery. My eyes were irreparably damaged, and I set up My Beautiful Eyes Foundation in January 2012, a patient advocacy group helping and advising people who've been damaged or people who are considering surgery. And slowly as time went by, I was contacted by many thousands of people who've been damaged by laser and lens surgery. I would never advise anybody who needs cataract surgery not to have it if they need it, but to risk your precious eyes unnecessarily just to lose glasses. I mean, I don't know how many pairs of glasses I need. And it seems to me just outrageous that all these people are going to the NHS for aftercare because the providers aren't giving any aftercare after 12 months. So the NHS is funding all this treatment and then handing out contracts to the same companies who are damaging patients. It is outrageous. They're only interested in money. And I've had the response from some saying, oh yes, but we're trying to help people. Sometimes, it goes wrong. You're not trying to help anybody. You're trying to make money. Thanks, Zaza.
Another day, another dollar. That's the longest eye test I've had for a while.
In Bootle, Liverpool, 68-year-old Nick Tinsley reached out to Sasha after his cataract operation went wrong in 2023.
Oh, my eyesight's much worse than what it was before I went for the operation. I frequently used motorways and noticed all those neon lights with like stars, which wasn't normal, and that's when I first thought to myself, I've made benefit from cataract surgery, and it was Spry who actually told me that, you know, I needed this operation. Well, I left, put the eye drops in, what he said, as per instructed, and I noticed it straight away that it was not right. Every morning I wake up with this stuck together, particularly my left eye. That eye, it droops now. It's got a droop. See, I can see in my peripheral vision a big mound of flesh. That wasn't there. Now that has a knock-on effect. It makes you irritable, makes me feel irritable. It's affecting my relationship, destroys your self-confidence. And like, this is the first time I've been out of the house for weeks. It's just not the same. It's in your face. You see, your remain change. It's not as though it's something wrong with your leg. Or even the others, my breathing. It will eventually kill me, but I can manage it. It's not a problem. My eyesight difference, stay all the time. Constant reminder. So it's every day. It just doesn't go away. It's just, I don't know. I'm not saying that some days I feel suicidal, but I can understand people who decide to top themselves when they think, this is what's left. You know, but it does have a big impact on my life. I'm just sorry I got involved with it all. You know how many times I've told you on the phone? I've been down the motorway in the night since I've had the operation. Do you know how many times? None. So what was the point? I mean,
Nick is still waiting to get referred back to Spry through his local opticians. For weeks, we have tried to get Spry to take part in our film. They declined. Czech, ACES, Optegra, and Numedica also declined to take part. The government didn't respond either, but in a Freedom of Information request, they told us they haven't met with any of the 5 companies in the past 5 years.
If we're going to look for blame in the situation, then you'd be better to look at how the pricing structures were set.
We have to be thinking more globally about how very scarce healthcare resources are allocated.
We need to look at how these contracts are being given out, whether we're getting value for money.
What you need to do is to ensure that the private sector is working in the interests of the NHS.
Because in the end it comes down to patient care, not just for cataract but for everything else. So what is the most sustainable way of delivering eye care to the population?
Get rid of the conflicts of interest which distort clinical decision making, cap the profits of the providers that are providing these services.
Given the money that is being spent on outsourcing cataract surgery, I think it could be better spent to set up units devoted to cataract surgery for the NHS to employ and pay the surgeons directly.
You know, there's always going to be a debate, and rightly so, about the involvement of private companies in delivering services to the NHS. You need to be taking action to cap profits, get rid of conflicts of interest, and allow the local NHS to plan the care needs of the population.
This is a story of a public-private partnership gone wrong. It's a growing burden on the NHS, and it could be putting all of our eyes at risk.